Greetings, this is the coronavirus COVID-19 update for 3/23/2020. And we look at the Baidu numbers first for China. This is China's search engine, and they set up a site on Baidu to track a lot of information. Cumulative diagnosis down there on the bottom left, 81,747. Overseas input keeps growing every day. Now they're tracking people bringing the virus into the country, up 74 from yesterday, and only 7 more deaths from yesterday. As you scroll down the page, you see a bunch of information. The first thing you see is this map, which used to look like the upper right, and what they're doing now is they're taking the cumulative cases minus the cures and deaths, and to show you how many cases a province has right now. So a lot of these provinces are turning very light colored, like 1 through 9 cases. This is the first of 3 graphs, and we're seeing the total number of new cases in China, 14, and 74 coming from overseas. And this graph used to be more useful. It plots Hubei province in the pink and the rest of China in yellow or gold, and then the dark color is all of China. So it's, basically they're all 3 lines are the same now. And this is the third graph that plots foreign new cases, 40,000 new cases out there in the world, almost 41,000, and domestic cases in China, only 147 new cases. And most of that is because they've added Taiwan and Hong Kong. And this is a list of provinces. I'll give you a breakdown by provinces. There's only one in Hubei. I used to open Hubei and take a look at all the cities like Wuhan inside, but now the whole province only has 1 case. Guangdong, 15 new cases. That's the most populated province in China, down by Guangzhou and Shenzhen. It's just, north of Shenzhen is just north of Hong Kong, so it's way down south. Beijing, 32 more cases. That's a lot. That could be a lot of foreigners coming in, though. Shanghai, 10 new cases. Hong Kong, 39, and Taiwan, 26. So, Taiwan and Hong Kong are nowhere near as cleaned up as China because, they didn't have the lockdowns that China had. Beijing, no, that's a pretty big number for Beijing. And then if you scroll down further, you see the hot stories of the day, the search topics that give you the top story. So we're going to take a look at 7 of these. So the first one, U.S., 5 million Americans may be unemployed. That's kind of a bullshit thing, maybe not. There's big, huge aid packages in Congress right now for $2 trillion. I think any conclusions you draw on the number of unemployed people is just crazy at this point. Millions of bunches of flowers destroyed in the Netherlands. Yeah, the demand for flowers worldwide has gone down, and the Netherlands is a huge exporter, so they're just, growing flowers and destroying them. And then we have 3 sports things are the next 3 top stories. Curry drinking wine through a mask, kind of crazy. An Olympic swimmer has coronavirus, and another Utah Jazz NBA player has coronavirus. And then we have a story, U.S. Secret Service confirms a new crown. Somebody in the Secret Service got it. And on the right, this is, this guy apparently has nothing upstairs other than mush where his brain should be. Ambassador to the United States talks about the virus coming from the U.S. military. Yeah, that happened. It came from damn Chinese people eating, strange food. Quit blaming the virus on the rest of the world. It grew up in Wuhan, China, in a wet market where you butcher crazy animals. Can't blame it on any other country in the world. It's your virus. You gave it to the rest of the world. This is just insane, this kind of bullshit. Chinese propaganda. Okay, then we go to the Johns Hopkins Global Tracker, which is done by the Center for System Science and Engineering, which is a research institute at Johns Hopkins. And this is what everybody on the planet uses for a global tracker. Total confirmed cases worldwide, 372,563. And then you can see a list of countries underneath that. China at 81,000, but no new cases there. Italy is trying to catch up with China, and the U.S. is trying to pass Italy. And we'll take a look at the individual countries. But 16,381 deaths, and total number of recovered people, 100,885. Then you can pause this and take a look at it if you want to take a longer look at it. But this is just the last few days of the same screen where I've highlighted Italy mostly. So they went from 4,000 deaths to 4,800, which is a 793 increase, which is a world record that they still hold. Then 5,400 to 600 some increase, and then yesterday was another 600 increase in the number of deaths, which is going crazy. Right now there's 6,000 deaths in Italy, which is double what China ever had, almost. China, I think, this is Hubei province, 3,153, and the rest of China is only 3,200 something. So Italy is just really, really doing a bad job of keeping people alive. And then Spain and France, also I put trackers in there for them. We'll take a look at each country. So we'll start out with South Korea, and I used to always talk about South Korea first because it was the worst place on the planet outside of China. If you take a look at the graph on the upper left, that's the orange line is South Korea. And then we have Italy, Iran, France, Spain, Germany, and USA. And they were the first, all of a sudden they went from 0 cases up to, like 800 or 900 cases. And then they went over 1,000, then over 2,000, then over 3,000. They were just leaping up there every day, sometimes 1,000 cases. From 3.1 to 3.2, they went from, they went up 1,000 cases in one day. And that's back when no country was doing that. So they used to be totally out of control, the worst country on the planet. Now I put them first because they're the best country on the planet. They are the model country. If you look at the graph on the right, it's the same graph, but it's extended all the way to 323 now. And if you can see that orange line, they're still at about 9,000 cases, and they haven't gone above that. They've got it under control. And those are, new cases every day are less than, today it was like 64 new cases, less than 100 new cases a day, and then hundreds of people get out of the hospital every day. So they're, infections are going way, way down. It's just, crazy how good they are. So let's take a look at why. Okay, I'm not going to go into detail here because there's another video just on South Korea. But if you take a look at the upper right pictures, the middle and the right, South Korea came out with this, testing kit just a few days after, or not a few days, 3 weeks after they got the information from the WHO. The WHO sent out a paper to every country in the world and says, these are the genetic markers that differentiate this coronavirus from other coronaviruses like common influenza, SARS, and MERS were both coronaviruses. This is a new one, and these are the genetic markers that you can use to identify it. So South Korea came out with test kits really, really fast on their own, and they invented new ways of testing people. You can see the right picture. There's a drive-through here where people are just driving their cars up and getting tested. When people had to be quarantined, they gave them this little quarantine kit and said, here, take this. They disinfected the whole country, just by having the army come in, and the army just went everywhere disinfecting. And then they found this miracle drug to use, Kaletra, which is an American drug made by AbbVie Incorporated, which is a spin-off of Abbott Laboratories. And the Kaletra is a new pill that contains lopinavir and ritonavir. So one's a malaria drug and one's a HIV drug. So this is what they use to cure everybody, so they have everything, they're just a model country. Everybody should do what they do. Unfortunately, not everybody's doing what they do. So new news out of Korea. The new news today is the lowest daily increase in coronavirus since February 20th, which is 64 cases. which is a miracle. 64 new cases in a day. Then we take a look at the other countries. So we have Italy, US, Spain, Germany, Iran, France. And I skip US because I investigate the other countries first. Because why? Because it's nighttime there already and their days are over with. So I save the US for last. So this is Italy. Things are going bad in Italy. We looked at the death rates before. If you take a look at the map on the upper left, you can see Lombardy province, a big red circle on the top. That's, that province has the cities and villages that are most affected. And why is the fatality rate so high? This is by Al Jazeera. Sometimes, these news services, I don't pay for news. If I can't read the news, I'll go somewhere else. Al Jazeera is a pretty good news source. So, I read this article, and I read all the articles, but, what they came up with here is what's going on everywhere else, where the fatality rate is so high. It isn't because the healthcare system's so bad in Italy. It's because they only test people that are about ready to die. There's plenty more cases walking around in Italy that people that aren't showing symptoms and haven't been tested yet. So if you take a look at the mortality rate just by looking at people that have been tested, people that have been tested are all positive. So you're not comparing the mortality rate with the entire population, or the entire population of people who have coronavirus, because you got to keep in mind the mortality rate in China was only like 3.4%. So 97% of all people who get coronavirus, it's they sometimes don't show any symptoms, or it's just a flu to them and they recover. Okay, so if you want to compare mortality rate, you have to do it on everybody who tested positive for the virus. The problem here is they're not testing everybody. They're only testing people with severe symptoms. Okay, the two stories on the right are about funerals and funeral homes. They're doing live streaming for both of them now. No public get-togethers, so you see your loved ones in a casket on Facebook. That's what they're using, Facebook. And on the bottom left, there's a picture here. There's a couple pictures. One person described this scene as the saddest photo in the history of his country, the guy that took the picture. And these are army trucks going into Lombardy province in the one town, I forget the name of the town, Bergamo, I guess. And they're loading up coffins and body bags, dead people, at a cemetery, because the cemetery, they were accumulating all these coffins and body bags. They didn't have any place to bury anyone. The cemetery's full. All the cemeteries are full. So they called the army. The army came to pick up all these coffins and dead bodies and cart them off out of the city to be burned. That's sad. So, and then there's a list that came out yesterday in a story, a list of companies that remain open. So the way Italy did this is they decided nationally all companies, corporations are shut down except for these. Okay? So who do we have next here? Spain. And Spain, let's see, patients film lying in hospital corridors. So yeah, this was a video that just showed, it's almost like China when it first started out. You can walk down a hospital corridor and there's dead people, laying there. And on the bottom left, this was a story from yesterday. This is a really big convention center or an exhibition center. Yeah, same thing. Turned into an emergency hospital, and you can see the cots are being set up here, and the first patients started coming here. A lot of cities are doing this. This is a good thing to do, and people shouldn't waste time doing it. Growing support for sealing off regions in Spain, not allowing people to move back and forth inside the country. Spain's caseload surpasses 33,000, and death toll surges to 2,100. And on the bottom right, there's a story about, some people discovered dead bodies in a retirement home, an older, retirement elderly care home. And then the army went in and looked, and there's there's all kinds of dead people that were abandoned there. Then we have Germany. Germany is really crazy. I spent a lot of time in Germany, so I know how crazy it is. But there's no stories here. This is Welt and Spiegel. These are two big publications in Germany, two big news services, and there's no news about Germany here. If you want to read about the rest of the world, go there. They don't say much about Germany. So on Spiegel yesterday, they had an article, why is the death rate lower in Germany? Well, because they compared it with Italy. That's why. That was a crazy article. Sometimes these people, writers are crazy sometimes. They write stories that might be true, but, they're crazy. They have a bachelor's degree in journalism. Okay, Welt today, what's coming out of there? Nothing. This is their coronavirus page. And on the bottom, Spiegel, this is their coronavirus page. No articles about Germany. But I did find one, and I found it yesterday too. There was more written today. The South Korean model. Is that what Germany should use? Yes, it should. You should use the South Korean model. News coming out of Tehran is crazy. For weeks it was we can't do anything about coronavirus because, for weeks they didn't have any, and then they had this big pilgrimage to this city, Qom, and to this temple here, and then all of a sudden they had a zillion cases because everybody's packed together in this area like sardines, and they're staying at hostels and bunk beds, and they're eating together, and they're eating off of the same plate with their hands, and they're licking the temple here to show people that they're not afraid of coronavirus. So what happens? Then they get zillions of cases. So as soon as a zillion cases started showing up, they said, "Oh, we can't fight coronavirus because of the U.S. sanctions." That's crazy. Nobody's going to lift the sanctions. You shot down a commercial airliner. First you sent a general to Iraq to kill Americans, and then when the U.S. killed him, you shot down a commercial airliner. You have sanctions. They're going to be there. If you can make a nuclear reactor, you can make a mask. So then we have what next? France. Death toll rises by 186 in one day. Lower left, we have a story from a couple days ago where a French company, a pharmaceutical firm, came out with this new pill that they say is looking good. And that's because why? Because it's the same thing South Korea is using, only this is the French version of it. If you look at the top pharmaceutical companies in the world, they like to say the top 25. France has one, and the UK has one. Switzerland has a couple. The rest of them are American. So, Germany has one too. And, this is a big pharmaceutical firm that, came up with their own malaria pill, which is exactly what South Korea is using, a malaria pill and an HIV pill. So other big news on the right, new restrictions. The Prime Minister is not happy with the numbers, so there's going to be new restrictions tomorrow. They ramp up the number of tests. I watched this video, and they're not really ramping up the number of tests. This is a doctor in the car. The only reason she's getting tested is she's a doctor. They're only testing people if A, you're a doctor or some kind of medical worker, or B, you're showing you have a temperature, which is a problem. That leaves people that are positive with no temperature running around spreading the disease. And the big news today was about this big trial that's going on that's involves, France, Belgium, Netherlands, Luxembourg, United Kingdom, Germany, and Spain. We'll go over that later, but there's a big clinical trial going on, and we have other data on that. And data's on the next page. I didn't know it was on the very next page. So this is news coming out of the European Union for just all of Europe together here, which is, the countries I named before. So this is a big clinical trial. And the WHO gave the European Union a list of all these drugs from all across the world that are showing promise. And if you can see on the right, this is the American drug is included in there. This is remdesivir. This is phase 3 of the clinical trial for this drug. So we're getting toward the end here. And it's on here twice because they have a clinical trial going on with moderate cases and then severe cases on the bottom. So this is the drug that cured, our first patient in the United States had a severe case. They gave him this stuff. He was okay the next day. They gave it to him in the evening. The next day he was fine. He had a cough. Then the USA. So the USA, this is a new looking graph here because Johns Hopkins went from doing cities. First they did states, and then they went to cities. No, the other way around. First they went to cities and then states, and now they're doing counties. So that's why you see all these red scatter points all over the place, because you can't see state data anymore. You can see counties. But you can see big blobs, and you can see that Seattle, San Francisco, New York, New Jersey, Boston, those are the hot spots. And then we'll talk about each one of these. So what happened today? Cases went up in the United States from 33,000 to 43,000, over 10,000 cases, which I've been doing this for a while. That's a new world record, 10,000 cases in one day, except for Wuhan. That's a world record for the rest of the world. And deaths from 417 to 557. That's a really big jump in deaths too, especially for the U.S. So I used another map to get the current data from states, and this is kind of crazy because a lot of these numbers are current, but I can't bank on Washington being current because that means Washington went from 1996 yesterday to 1997 today, up one case. But the other numbers are accurate, like the number for New York is accurate and up to date. So what happened yesterday, or from yesterday to today, we went from 33,000 cases to 43,000, almost 44,000, up 10,000 cases in one day, which is a new world record. I don't think you read that in the news anywhere, but it's a record. I've been doing this for a while. Deaths up from 417 to 557. So 100 and, that's a big number for the United States. To go up 140 cases, or deaths, that's a really big number. Then Washington, news from Washington. So on the lower left, the big news from Washington this week was on Monday, a clinical trial for a vaccine started. So that's really, really good news. And, hopefully we'll see there's 45 people, and it's going to take about 6 weeks. And it started on Monday. So we'll keep tabs on that. Yesterday, Trump approved Washington's emergency disaster declaration. Maybe that was 2 days ago. And yesterday, this doctor said that, the true numbers are way off, the number of cases in Washington because of testing, a lack of testing. More cities issue stay-at-home orders. This is inside. Seattle hasn't done it yet. This is inside the state of Washington. But there's a list of cities that that were underneath here. Seattle hasn't done it yet, but a lot of other cities that are, especially in the 3 counties that are south of Seattle. And then here's a death in another retirement community, adult care center on the right. So hopefully we won't find 50 deaths in there like in the other one in Kirkland. Then we have California. What's going on in California? Well, news from yesterday. First, there was a California guy, 34-year-old California guy, Southern Cal. He was confirmed with coronavirus, and like 2 days later he died. So this is a young person dying, which is not typical. And California seeks first weekend stay at home, and this was an article, about people, some of the news agencies being out to watch and see if it actually worked. And then we have beaches closing down. I think this might have been Venice Beach, this photo here. And then what do we have new today? This latest headline, 1,733 cases, 33,404 nationwide. That's down. It should be 43,000. And then we have a couple more states closing non-essential businesses, and then we have numbers in the same article on the right. 24 cases from repatriation from flights, 120 other travel related, 165 due to close contact, 474 community transmissions where people just got the disease from nobody, from walking around. and 950 under investigation. Then I have two uh, screen prints of the same map here to show you the increases. California is not that out of control. If you look at Los Angeles County, which has the most cases, the blue on the the lower part of the map, 409 cases yesterday, 536 today. So they're not in the thousands going up 10,000 a day like some states like New York. Okay, what's going on in New York? Yesterday, Cuomo warns young people because of that 34-year-old guy dying, and another study that was in Southern Cal, and another study showing that most of the cases are people under 50. And then here's the governor of the state of New York say he's getting mad. Why is he getting mad? Because he sees New York City people out. New York City's under lockdown. You look at Times Square, it's under lockdown. You look at Central Park, that's where everybody is, So it's crazy. This, New York is not really locked down, and he's telling Cuomo to get a plan together by tomorrow. And, how you're going to, police people means putting a lot of police in Central Park, probably. And then the bottom picture shows where these 4 locations are where they're setting up hospitals. And on the upper right, Trump, approved the National Guard to go in there, and they're setting up a makeshift hospital in Javits Center. And on the map on the lower right, that's the state of New York. So it's really confusing. I worked in New York, and a lot of people, wonder what these numbers are. So if you look at the number on the upper left, 20,875, that's the state of New York. How does that break down? The city of New York, 9 million, the metro area, 19 million. And how's it 19 million? Well, you include, all of Long Island, you include coastal New Jersey along the Hudson, you include southwestern Connecticut, Westchester County, and that's like considered the tri-state area or the greater New York area. But if you want to see what any individual city is in New York, you just have to go to these state maps and roll your cursor across it, and it'll tell you, like here, New York City, 13,119. If you wanted to see Long Island, you move it to the right a little bit. Then we have New Jersey, and the governor of New Jersey is stating here he's adding more testing sites. On the bottom, we have 500 new cases and 4 more deaths. And, on the left, we have New Jersey residents ordered to stay at home, but that wasn't happening very much in New Jersey either. On the upper right, they're setting up new testing areas, but this is another thing that's kind of crazy because, I watched a video on this, and these are new testing areas, these tents, but they're only going to be for A, medical people, or B, people showing symptoms. If you want to have a test done, not that there's a lack of tests now, there's probably enough test kits, but there's not enough people to test the entire population. So you have to have a fever to get a test, which means there's still going to be a zillion people spreading coronavirus around because they don't have any symptoms and they're carrying the virus. Then also the mayor, I think is a mayor, or maybe it's, the governor, or maybe it's a mayor of a few different towns. I don't know exactly what this is, whether, West New York or what, but these are some areas of cities, and these red zones are like don't go outside zones. So that's, something that got defined today. Okay, general news, upper left, Europe, smartphone location data. They're doing this in South Korea. They did it in China. But, Europe is not so sure they want to do this. This actually came out yesterday on the Spiegel, the Mirror, where a German official wants to use cell phone data. And then he took it down the next day because he got a lot of criticism for publishing something like that. But this could actually, it could actually be used to track people who have coronavirus and make sure they stay at home. Virus outbreak, it shows New York City, that's Times Square there. There's a policeman walking across the road and there's nobody else around. And then majority of New York COVID cases are people under 50. Yeah, but not the people that die are over 70 usually. On the right, Georgia, governor orders bars, clubs, and restaurants closed. Another state hops on that. Officials warn against self-medicating. There's an older couple here that thought they would take something to get rid of coronavirus, and they died. Virus outbreak, testing blunders, crippled U.S. responses. I have another video on that. The name of the video is A Test for the Prosecution of the CDC, the Center of Disease Control. They're the ones that gave us. We should have been a country that had everything under control from the beginning. But what happened? We didn't have any test kits because these people, these idiots that work at the CDC thought, test kits, yeah, just mail them to us and we'll do the testing. Smoking some crack. That's why we're in this kind of condition now, because the CDC doesn't know what they're doing. WHO, at least 20 coronavirus vaccines are in development in the world. This is an Israeli guy working on a vaccine. And on the right, coming out of China, antiviral treatment called remdesivir. Remember that? That's the drug that was given to the first American. It's a miracle drug. It's in clinical trial now. And it's already in the final stages of clinical trials in Asia, too. So it's in final stages of clinical trial in Europe and also in Asia. And things are looking good for it. Okay, what do we have here? This is a graph that I made for the United States only. And as you can see, way back in 2021, we're at 16 cases. And then we started repatriating people from that cruise ship in Tokyo Bay, the Diamond Princess. And then when that put us up near, up to the 60s and 70s. And then, lately it's just been going crazy. 43,963 cases now. We're at the steepest, most increasing curve in the world right now. And it would be worse if we tested more people. Like I just said, New York and New Jersey, nobody's getting tested unless you have symptoms, which is crazy because, infected people are walking around. And this is a graph that we looked at earlier with South Korea. But let's take a look at other things on it now. You have the United States in dark blue here, and you can see we flew by everybody else in Europe, and we are heading up to meet Italy. So the U.S. is just going crazy in numbers, and half of the U.S. is New York City. Okay, that's all we have. I appreciate your time.